My name is Allison Thurber, and you are currently in session one of a two-part mini-series with today's topic being standard precautions and hand hygiene. I welcome all of you to introduce yourselves in the chat box and add where you're from. I always love it when we can see where everyone's from, who's participating that day, to get a better idea of how we can apply all of the concepts we're talking about. So before the session starts, I just wanted to take a moment to go over our continuing education criteria for those of you who are attending to receive CNE credit or the Nursing Continuing Professional Development credit. So this is a 30-minute session that is approved as a Nursing Continuing Professional Development activity by the Northeast Multi-State Division Education Unit, an accredited approver by the American Nurses Credentialing Center's Commission on Accreditation. This is the first part of a two-part series, each 30 minutes long, which will then get you one CNE credit after all is said and done. So in order to receive your CNE credit, these 4 steps must be completed. So step 1, if you haven't already done so, I sound like a broken record already, but please complete the pre-session survey prior to starting the training. My colleague Abby has been adding the link to the chat, and we'll do so again so you can access that pre-session survey. If you still haven't done this, again, please go ahead, take a moment to complete this now. The survey does close at the start of the training. Step 2, second step is to attend this live training. You're here, check. We've done something productive on a Monday. Step 3, you must complete the post-session survey after this training ends. The post-session survey will be emailed to you tomorrow. And then step 4, you must complete the post-session quiz. A link to the quiz will also be emailed to you tomorrow. And that quiz is required as a requirement by the CNE accreditation. So make sure you do all of that. And this training is part of a 2-session series. So as I've mentioned, you must then attend the next session, Source Control and PPE, on Monday, September 11th at noon to qualify for that one full CNE contact hour. And again, this is only if you are going for the CNE contact hour credit. For our other healthcare colleagues today who are here, who are opting for certificates of training, EMS continuing education, dental IPC continuing education, items 1 to 3 here are required in order to get that certification, while number 4, the post-session quiz, is optional. But again, that's required for the CNE. So taking a look at our agenda today, we will complete welcome and introductions as well as go over our CNE requirements. Did that. Then we'll dive into our content. First, we'll start with standard precautions. We are hoping to understand the importance of standard precautions and be able to recognize risk in a work setting and then appropriately apply different aspects of standard precautions. And then from there, we will discuss hand hygiene, hoping to understand how effective, appropriate, and timely hand hygiene can decrease the spread of infection. At the end of today's session, we will review our key takeaways and lastly go over some announcements, future sessions, end of session feedback, and then we will host our live Q&A if you have any questions. As the session goes on, please use the Q&A box to enter any questions you may have for our Q&A at the end of the training. So most of you will have either at the top of your screen or the bottom of your screen a bar, which will have Q&A, chat, where you could, if it was allowed, to start or stop your video or mute or unmute yourself. So you should see a chat, which is a separate feature we will use today. But then you'll also see the Q&A box. If you have any questions, formal questions that you want answered at the end of the session, put those in the Q&A box and reserve that chat box feature for any sort of like attendee interactions and communications with our team. All right, so we have all of our front of the house business completed. So I want to thank you all for having me today to lead our refresher session training on standard precautions and hand hygiene. Again, my name is Allison Thurber, and I'm a nurse at the Rhode Island Department of Health and a training liaison for Project Firstline Rhode Island. So throughout my nursing career, I've worked in a variety of settings: inpatient, outpatient, ER specialties, and public health. And while all of these settings require a different skill set, one thing that has remained universal is my understanding and application of infection control and prevention strategies. One of the main concepts of infection control and prevention is standard precautions. So today we're going to dive deeper into what standard precautions are, how we can use them to protect ourselves and all the people we serve to protect. And then we will discuss in more detail a very important aspect of standard precautions, which is hand hygiene. So what is effective hand hygiene? When do we use it? How do we use it? And why is it so important? All that said, I am super happy to be with you today and hope that throughout the presentation, you all take the opportunity to engage and share your experiences and knowledge with your fellow colleagues. And again, you can do so in the chat box. Questions can go in the Q&A box. All right, so let's get started with standard precautions. So standard precautions are the minimum infection prevention standard for healthcare workers in all healthcare settings. These practices are used to prevent transmission of diseases that can be acquired by contact with blood and body fluids. So think of all the rooms you enter, every patient you encounter, every coworker you interact with as potentially contaminated or infectious. No matter how emergent you feel a situation is, or how pressed we are for time, adhering to standard precautions is critical for the safety of everyone involved. Standard precautions is about looking at a situation or a patient, anticipating the risk, and then taking the appropriate safety steps to prevent any harm. Standard precautions are used for all patient care. They're based on a risk assessment and make use of common sense practices and personal protective equipment that protect healthcare providers from infection and prevent the spread of infection from patient to patient. Standard precautions are frequently where healthcare workers do sometimes get complacent, right? We're so busy. So the extra few minutes to wash our hands thoroughly or make our way over to the sharps container can seem like the least of our worries. But in the end of the day, it is really the things that we do every day that make a large difference in the control of infection. So standard precautions includes hand hygiene, the use of personal protective equipment like gloves, masks, eyewear, based on anticipated risk, respiratory hygiene and cough etiquette, safe injection practices, cleaning, disinfection, and sterilization, including instruments and devices, laundry handling, and waste management. And we're going to break down each one. So hand hygiene, cleaning your hands with soap and water or alcohol-based hand sanitizer is the best way to prevent infection. In the healthcare setting, in most instances, alcohol-based hand sanitizer is the preferred method of hand hygiene. And I truly just kept this slide really brief because we are going to review hand hygiene in depth later on in the session. So personal protective equipment is also known as PPE. Personal protective equipment like gloves, masks, eyewear should be used whenever there's an expectation of being exposed to infectious material. For example, if you're removing a tick, you may want to put on gloves to decrease the risk of a bloodborne pathogen transfer when in contact with that attachment site. Or another example, you're changing a dressing that's on a saturated wound. So you put on goggles, anticipating that there may be some splashes and sprays. Another part of standard precautions includes respiratory hygiene and cough etiquette. So this involves wearing masks when appropriate, like when community transmission of respiratory illnesses like COVID-19 or influenza are high. Also, when patients have respiratory symptoms. It also involves covering a cough or educating a patient about covering a cough, sneezing into your elbow, wiping down known contaminated surfaces that you just sneezed or coughed on, and providing tissues and receptacles for respiratory waste. This also includes providing space for and encouraging staff with respiratory symptoms to distance from others and remain home while they're ill to prevent the spread of infection. Safe injection practices and sharp safety is also part of standard precautions. So occupational exposures to bloodborne pathogen, because of mishandling, needles and sharps results in over 385,000 injuries a year in healthcare workers. Prevention strategies can include not filling the sharps container over the fill line, appropriately discarding of sharps, carefully handling and cleaning sharps, like using the built-in safety mechanisms, and carefully handling waste in case it includes sharps and wasn't disposed of appropriately. Cleaning, disinfection, and sterilization practices are also crucial to infection prevention and standard precautions. Environmental surfaces like high-touch items, computers, bedside tables, light switches, writing utensils, doorknobs, med carts, anything that's touched frequently should be cleaned and disinfected. Reusable invasive medical equipment should be sterilized according to product manufacturer by staff that are specially trained to do so. So laundry handling. Laundry handling is also included in standard precautions. It is important to handle contaminated materials and fabrics gently to avoid contamination of air, surfaces, and persons. Contaminated fabrics should be bagged or contained as soon as possible. Also, it's important to be sure that clean linens are stored, packaged, and transported in a way that maintains their cleanliness. And the last aspect of standard precautions is waste management. So waste should be disposed of properly. And if there is waste that is saturated in blood or body fluid, be sure that it makes it into the medical waste bag and does not end up in the traditional trash. So I would like to pause here and take the opportunity to share ideas and hear from each other. So let's take a moment and discuss a time when you recognize an infection control risk and share how standard precautions helped you to reduce that risk. If you feel comfortable, you can share your experience in the chat box. I'll go ahead and give you a minute to think and to share. Open up my chat box here. Anything you can think of. I know in the ER, I would apply standard precautions a lot because you don't always have, set precautions yet. Someone is just coming in, so we don't know what kind of precautions to take with someone. So we're going to use standard precautions, anticipating the risk that may happen if there's blood or if they're vomiting. You want to make sure you're wearing the appropriate PPE. Maybe we're not chatty today. Go ahead. Feel free to add it to the chat box. I'll continue to move on, but you can still continue to have the standard precautions conversation in the chat box if you'd like. If my computer would like to advance. There we go. So next part of this presentation will focus on hand hygiene, also known as cleaning your hands. Practicing hand hygiene is a simple yet effective way to prevent infections in healthcare settings. Hand hygiene, which means cleaning your hands by washing with soap and water or using an alcohol-based hand sanitizer, is one of the best ways to avoid getting sick and prevent spreading germs to others. So we're going to start with a little true or false question. So you will see a poll pop up on your screen and you'll just select the best answer. So CDC recommends the use of alcohol-based hand sanitizers as the primary method for hand hygiene in most healthcare situations. Is this statement true or is this statement false? And while you guys fill that out, I'm just going to look at the chat. It looks like someone responded, washing your hands after toileting a resident. Yeah, so that is an application of hand hygiene in standard precautions. Thank you for sharing that. All right, so looks like most people answered true, about 30% answered false. So this statement is true. Most of the time in healthcare facilities, it is preferred to use an alcohol-based hand sanitizer over hand washing due to evidence of better compliance compared with soap and water. So hand rubs are also generally less irritating to the hands and are an effective method of cleaning your hands. There are certain times when hand washing should be used instead, and we will discuss that next. So here you can see different situations where you would need to clean your hands, and we'll go through each task to discuss which type of hand hygiene is recommended, either hand washing with soap and water or with an alcohol-based hand sanitizer. So first, we have after caring for a patient with C. diff, spores, or known infectious diarrhea. That is a time when it is recommended that you wash your hands with soap and water. You need to make sure that you get anything off your hands that's visibly soiled, and those spores are not killed by the alcohol-based hand sanitizer. Immediately before touching a patient, it is recommended and perfectly acceptable to use an alcohol-based hand sanitizer. When your hands are visibly soiled, it is recommended that you wash with soap and water. Before performing an aseptic task or handling invasive medical devices, you can use an alcohol-based hand sanitizer. And after contact with blood, body fluids, or contaminated surfaces, you can use an alcohol-based hand sanitizer. The only exception would be if your hands were visibly soiled, right? And then you would want to wash with soap and water. Before eating, it is recommended that you wash your hands with soap and water, and also after using the restroom, soap and water. After glove removal, after touching a patient's immediate environment or touching a patient, and before moving from a soiled body site to a clean body site, it's perfectly acceptable for all three to use an alcohol-based hand sanitizer. So the last three there are alcohol-based hand sanitizers. So again, in healthcare, it's recommended to use an alcohol-based hand sanitizer to perform hand hygiene, except when hand washing is indicated. And the instances are when you're caring for a patient with C. diff, spores, or infectious diarrhea, when your hands are visibly dirty, before eating, after using the restroom, special circumstances, of course, like scrubbing in for surgery, which is its own beast in itself. And then other considerations could be in psychiatric services, maybe, where the use of alcohol-based hand sanitizer may be contraindicated. You can't keep it on the unit, so you would need an alternative method. So some details about hand washing. Soap and water removes all harmful bacteria if performed correctly with an antibacterial soap in healthcare settings. The CDC recommends when you're cleaning your hands with soap and water that you wet your hands first with water, apply the amount of product recommended by the manufacturer, and then you rub your hands together vigorously for 15 to 20 seconds. Cover all surfaces of your hands. Make sure you get, the bottoms of your hands, the tops of your hands, all your fingers. Then rinse your hands with water and use disposable towels to dry your hands. Then you're going to use that disposable towel to turn off the faucet if it's a turn or touch knob. Try to avoid using hot water because sometimes that'll dry your skin out or make your skin crack, and that's no good for infection control either. And then we have alcohol-based hand sanitizer. So alcohol-based hand sanitizer kills most harmful bacteria when performed correctly. When using an alcohol-based hand sanitizer, it's recommended that you put the amount of product on hand that's recommended by, sorry, I just lost my spot. Put the amount of product that's recommended by the manufacturer. Then you would cover all surfaces until your hands feel dry. Altogether, this takes around 20 seconds. So again, this is most commonly recommended in healthcare facilities because it's been linked to higher rates of compliance. But we did review together when it is acceptable to use alcohol-based hand sanitizer and when you do need soap and water. So we are ready for another quick knowledge check. It is best to use the hottest water tolerable to wash your hands so that the heat can kill the germs. Is this true or is this false? Go ahead and select your best answer on the screen, hit submit. Great job. Looks like 100% of you were listening and selected false. So frequent use of very hot water can cause skin breakdown and cracking. Friction and technique during hand hygiene is more important to the process than the actual water temperature. Alrighty. So our team has compiled a list of frequently asked questions that I thought we could review together and kind of bust some myths. So first question, is it safe to wear nail polish at work? The answer is kind of a yes and a no. So hand hygiene has decreased effectiveness in the presence of chipped nails. Freshly applied nail polish does not increase the number of bacteria recovered from the skin, but chipped nail polish does support the growth of organisms. So your answer, nail polish is okay, but if your nails are chipped, then that's not okay. I'd also like to point out that every facility does have a specific policy that can be more strict to their liking, and it should be adhered to as an employee of that facility. So make sure you know your facility's policy on nail polish. Question 2, do you need to wash your hands if you wear gloves? Yes. Gloves protect you, and they also protect your patients and your colleagues. So use gloves when indicated and change them in between patients and tasks. Do not wear gloves when not required, when the risk does not indicate, or during different tasks without cleaning your hands in between and changing gloves. Glove use is not a substitute for hand hygiene, so make sure that you're always cleaning your hands after removing gloves. Question number 3, does alcohol-based hand sanitizer contribute to antibiotic resistance? And here the short answer is no. Alcohol-based hand sanitizers kill germs, including antibiotic-resistant germs. And lastly, where can you find material and resources for yourselves and your staff? CDC Clean Hands Count campaign provides hand hygiene visuals and educational materials for healthcare worker staff and patients in multiple languages. So we have added the link to the Clean Hands Count campaign to our post-session resources that you will receive at the end of today's session or after today's webinar if you're interested in having this material. So that concludes our active learning for this session. So let's review our key takeaways. Standard precautions are used in all healthcare settings for all persons receiving healthcare. Standard precautions involves the anticipation of risk, followed by infection control steps to help decrease or alleviate that risk. Hand hygiene is a crucial infection control tool. Cleaning hands by using alcohol-based hand sanitizer is the preferred method in healthcare settings. But as we know, and as we learned, there are certain circumstances where hand washing must be performed, and it is important to know when. So before we wrap up, I would like to remind everyone that about the certificate of training requirements. So requirements include a pre-session survey. You should have all filled this out prior to the session starting. And then participation in this live Zoom webinar. We will send out a post-session survey that will be emailed tomorrow, August 29th. This closes September 4th at midnight, 1 week from today. Then certificate of training will be emailed to you September 7th. So again, this is for the certificate of training. However, if you are looking to receive CNE credit, you must complete all the requirements that we talked about previous, plus attend session 2 and complete the requirements for that course as well. For CNE credit to be given, Project Firstline is required to supply a quiz. So please be sure, if you're looking to receive CNE credit, that you complete the post-session quiz that will be emailed to you tomorrow with the rest of your post-session documents. If you have any issues or any questions, please feel free to email our team, but I hope that this made things a little bit clearer. If you did not enter your email earlier in the chat box, please feel free to enter it now to be added to our distribution list of upcoming trainings. You can also click on our live events link through our website, and Abby will post that in the chat box as well. Also, please follow Project Firstline on social media. We have Twitter, Facebook, Instagram, and LinkedIn, and we are really interested in building our online social media presence. So it would be really great if you could follow us. For future trainings, Project Firstline has 2 upcoming trainings. The first I would like to bring to your attention is what we have mentioned all session, which is the second half of this mini series. So for those that are looking to obtain the CNE credit, the second part of this course is titled Source Control and PPE, and will be held on September 11th at 12 noon Eastern Time. Again, you do need to attend both parts of this 2-session series to receive the CNE credit. If you are not looking to obtain CNE credit for this course, we would, of course, love to have you, but it's not required that you attend part 2. I'm also excited to announce that my colleague Stephanie Doyle will be presenting a new course about C. diff and its clinical indications on September 25th at noon. 1 CNE credit contact hour will be available for this course as well. It is the first of what we hope to be a successful deep dive into healthcare acquired infections and some antibiotic resistant organism trainings. To register for these trainings, you can click on the registration links that we have placed in the chat box. Here are references. And I invite you to please take the 3-session poll on your screen. It is the end of session feedback. Helps us to improve future sessions and assess the community learning needs. All right. If there's nothing else, we will end now. Please feel free to email us any questions. I thank you all for your participation today and hope that we see you in future sessions. Thank you so much.